Good morning, everyone.
Good morning.
Good morning. My name is Melinda Heine. I have refractory epilepsy. I was born with it. I'm here to give you just a glance at patient's perspective. Thank you for listening. Article 25 of the Universal Declaration of Human Rights states that everyone has the right to a standard of living adequate for the health and well-being of himself and his family, including food, clothing, housing, and well-being of himself and his family, including and medical care, necessary social services, and the right to security in the event of unemployment, sickness, disability, widowhood, old age, and other lack of livelihood in circumstances beyond his control. Vermont's House 100 and Senate 88 bills, which are Vermont's universal health care bills, are the best blueprint and representation of what we can strive for nationally. Everyone would receive health care regardless of their ability to pay while being able to choose your care and go for out-of-state care. This would shut down private insurers altogether, guaranteeing highest quality and preventative medicine regardless of income or status. Vermont's way ensures that health care is a human right. What universal health care reform would mean to a patient like me, well, after a decade of craniotomies, research, progress, therapy, and treatment with the same wonderful neurological team, I wouldn't show up for an appointment to be told without warning that I was no longer allowed at that facility due to private insurers changing because they will cease to exist. When I go to find new care for myself while being disabled, I will not have to wait for a referral appointment with an undereducated PCP who is unfamiliar with my condition, resulting in he or she recommending things that can endanger my health and ultimately my life. Moreover, waiting even longer to get into the specialist. Humidity. Once I'm in with the doctor, my main concerns are staff education and prescription coverage. One thing I've found to be the most beneficial is the Patient's Assistance Program. For those of you that are not familiar with this is a program where drug makers such as Johnson & Johnson pay 100% of your prescription. It's a great program, but it's not the easiest or the most timely to get on. Many epileptics are not high functioning, and the littlest tasks are difficult. So the healthcare professionals should have readily available information assisting the patient in cutting down the red tape. Fortunately, I've found great specialists. However, quarterly education for their staff on new advancements and triggers for people with epilepsy should become mandatory. When you're dealing with a person who has a seizure disorder, sometimes even a slamming door can startle them into a seizure. The staff's demeanor and care is just as important as the specialist caring for the individual. Next, everyone knows why people wear pink ribbons. Why do we not have this awareness for epilepsy? Public education system can create understanding and raise awareness amongst our youth. Everyone may know someone with a seizure disorder during their life, whether or not they are aware. Seizure protocol and mental health specialists should be mandatory in the public school systems and available at all times as a means of coping and reducing stigma. With awareness starting at an earlier age, stigma is less likely to exist. The workforce today is absolutely ill-equipped to work with people with epilepsy. This is my #1 challenge. First, I have to be able to find work. The listing that says we'll work with seizure disorders are few and far between. Hopefully insurance is an option, and then we wait for that. Since seizures are very dangerous to me, causing me to miss work, injury, and not be functionable for some time after, then the challenge comes into play of when and whom do I tell, How do I tell them? Do I have to go through seizure protocol with them? Yeah, I do. Will they let me go right away? Probably. Are they going to treat me differently? Well, I don't have any solutions for these. I've worked with good, bad, and mostly just uninformed people, and that's why we're all here. So good luck to everyone here. Thank you for letting me speak. This has been a pleasure and a challenge, but a triumph for me personally. So thank you for letting me get up here and be a part of this. Good luck to everyone.
Thank you.